Welcome to Resolve IBS and IBD Naturally. I'm Courtney Cowie, a nutrition therapy and functional diagnostic nutrition practitioner. If you are struggling with the symptoms of IBS or IBD and want to get to the root cause of your symptoms so you can take back your health through a whole person approach, this podcast is for you. Just a disclaimer that the information I'm presenting in this podcast is for educational purposes only and should not be taken as medical advice. You should always consult a qualified practitioner before making any changes to your health or medical regimen. That being said, let's get on with the show. So today I wanted to dive into the topic of SIBO, which stands for Small Intestinal Bacteria Overgrowth. I find that this particular topic tends to sort of ebb and flow out in the functional medicine community. And I feel like in the last 5 years, especially, there's more and more just lay people out there that are hearing about this, getting interested in it, and then trying to do their own research and even self-treat when it comes to small intestinal bacteria overgrowth. So I do want to talk a bit about it and also talk about sort of the controversial idea that I don't feel that is necessarily the true root cause of most gut dysfunction. Not to say that it can't be a contributing factor and a significant one at that, but I'll give you a little bit more about my perspective on that as we kind of go through this talk today. So first of all, what is small intestinal bacteria overgrowth? Let's just define that. It's really a condition where the body's own commensal bacteria, which is typically the normal beneficial bacteria that live in the colon where they're supposed to predominantly live, end up actually migrating up into the small intestine, flourishing and taking up residence there where they really shouldn't live. And then that can cause all kinds of symptoms, everything from bloating to stomach pain to altered bowel movements, whether it's loose stool diarrhea or constipation. Sometimes they can alternate back and forth. And then it can also come in conjunction with other gut symptoms. Even things like acid reflux can come hand in hand with small intestinal bacteria overgrowth. But it is a big concern because, first of all, people who struggle with SIBO will often say they feel bloated. They can sometimes even see a change in the level of bloat visually in their stomach, especially morning to evening. The more they eat throughout the day, that food, some of it will continue to stay in the intestinal system, feed that overgrowth of bacteria, and literally cause them to visually bloat out a bit over the course of the day, which is no fun. Obviously, on the bowel end of things, it can be super problematic and uncomfortable because people will have sudden bowel issues where they'll have to run to the bathroom at unexpected times. And then again, things can just be problematic in consistency, whether too loose or constipated. And that, of course, is just a pain to deal with on either end. The thing also about small intestinal bacteria overgrowth that sometimes people don't realize or consider, especially if you're struggling with this, is that it's not just the gut symptomology. There's also this reality that when you have a condition like small intestinal bacteria overgrowth, that bacteria is actually living in the small intestine, which is the part of our digestive system that's responsible most for nutrient absorption. And so because of that, when those microbes are taking up residence in the small intestine, rather than your food particles coming through the small intestine, getting absorbed directly into the bloodstream to circulate and feed the cells of the body, what's actually happening is that those microbes then digest them and it becomes substrate to feed those microbes. And so what always goes hand in hand with SIBO to a certain extent is malabsorption issues and malnutrition. And so depending on kind of your genetic potential and metabolically just where your body's at, sometimes SIBO can actually cause people to lose weight or gain weight, depending, simply because their body isn't getting adequate nutrition. This can also lead to secondary issues like chronic fatigue, hair loss, skin issues, anxiety, depression, brain issues, because again, when we're not properly absorbing our nutrients, it's going to start to impact other systems of the body, whether that's brain function, skin, hair growth, etc., right? So it is a pretty big deal and something that I always suspect could be part of the picture. I always suspect it in the case of my gut clients, but I often suspect it in the case of my chronically inflamed clients, whether they're dealing with an autoimmune issue or something else. It's just super, super common. So, before we talk a little bit more about just my training in SIBO and ways you can actually deal with this both dietarily and in other ways, I wanted to touch on what is thought to cause small intestinal bacteria overgrowth. So, there's a little bit of debate on this topic in functional medicine, but it's really thought to be kind of a culmination of many different factors. First and foremost, not having enough stomach acid and just in general lacking proper acid at the level of the stomach, as well as not having sufficient pancreatic enzymes. So you might have heard me talk a bit about upper GI function and how important that is. Specifically, the stomach and the pancreas are some of the first two GI organs to work on food after you've actually swallowed it. And so if there isn't sufficient acid or sufficient enzymes, that process of properly breaking down the food doesn't happen. And then when it finally does move into the small intestine, it's not in its most readily digested form, and that automatically puts a burden on the small intestine to do extra work to break it down. And even if the small intestine does its job really well, the truth of the matter is just the fact that there wasn't sufficient hydrochloric acid or enzymes being produced, the food will only get broken down to a certain extent. This automatically sets up a very opportunistic environment for bacteria to overgrow and other pathogenic organisms to thrive in the small intestine where they shouldn't be, because again, these organisms will go where there's an easy source of food, and that's essentially what can happen as one possibility that might lead to an expression of SIBO in an individual. Another thought around this entire condition is that it can sometimes happen as a result of food poisoning. So I'll just speak at this point to the fact that it's thought that up to 75 to 80% of all IBS cases, whether it's IBS-D or IBS-C, have SIBO underlying them. They're almost sometimes used as interchangeable terms, seen as one and the same. They're not exactly one and the same, but there's a very, very high correlation between those two conditions. And one of the possible etiologies of IBS actually is a food poisoning event. So eating some kind of contaminated food at some point in time, leading to acute stomach poisoning or food poisoning, and then whether that person actually remembers having a bout of diarrhea, vomiting, what have you, for a few days or not, this is often what will set off IBS in cases, right? And then what can happen then as a residual fallout to that episode is that the small intestinal function can become altered, in that it can start to set the stage for small intestinal bacteria overgrowth. So that's another potential I guess you could say reason underlying SIBO. Kind of goes hand in hand with what I just spoke of, but another potential reason that would explain small intestinal bacteria overgrowth is what's called a deficiency in the migrating motor complex. And the migrating motor complex is the mechanism by which the small intestine moves through food through the intestines over a period of time. And there's ideally a certain frequency of wave-like motion that should be happening over a period of time. And what can happen in people that are prone to small intestinal bacteria overgrowth is that migrating motor complex can start to underperform, meaning that the small intestine isn't going through and creating this peristaltic wave that kind of sweeps food through it the way it should be, which then can kind of result in this like backup or residue that isn't getting kind of moved through and cleared. And again, that creates an opportunity for bacteria to basically have food to feed off of and proliferate. I'm thinking about other causes. So some more obvious ones, or maybe this isn't so obvious, any long-term use of proton pump inhibitors or acid-reducing medications, obviously, just like having insufficient stomach acid will absolutely set the stage for small intestinal bacteria overgrowth, simply because they're artificially shutting down the stomach's ability to create stomach acid, thereby leading to a lot of maldigested food going into the small intestine, which can then lead to small intestinal bacteria overgrowth. I would also include in this range of possible underlying causes things like leaky gut and food sensitivities as well, simply because they both go hand in hand with intestinal inflammation. And conditions like SIBO are always going to exist in an inflammatory gut environment. So anything that's leading to any kind of breakdown in the digestive process, but especially leaky gut, because that happens right at the level of the small intestine, is going to set the stage and potentially correlate with a higher degree of small intestinal bacteria overgrowth. So that's kind of in a nutshell some of the different factors that can lead to small intestinal bacteria overgrowth. So I just want to mention that a couple years ago, I did Dr. Alison Seebecker's SIBO Pro Course training for practitioners, which was actually a very excellent training, and did it at a time where I was kind of on a deep educational rabbit hole myself, just looking at different components of aspects of gut health and trying to get super knowledgeable on just what causes the gut to break down. And of course, SIBO had been on my radar for a while. I find Dr. Seebecker's work really good, so I definitely opted into the training. I got a lot of value out of it. In going through it, it actually opened my eyes to other things that are not specifically SIBO that relate to gut function, that can be sometimes deeper level issues beneath the SIBO that are often really important to look at, especially in cases where a client has tried multiple strategies to eradicate small intestinal bacteria overgrowth without success. And I'll kind of go into that in just a moment, but suffice it to say that in that training, we covered the gamut in terms of approaches to basically clear small intestinal bacteria overgrowth, including, of course, nutritional strategies to minimize the symptoms of it. What I want to say about the nutritional piece of this is that there are certainly dietary approaches that can help minimize the symptoms of small intestinal bacteria overgrowth, but in and of itself, you're not going to be successful at clearing it with just diet alone. It doesn't matter, how restrictive you go with your carbohydrates. In most cases, these are infections and overgrowths that are at a level that without a stronger nudge to clear the bacteria from the small intestine, often will find ways to continue to sustain and proliferate no matter what you do with diet. However, that being said, I still use dietary approaches in cases of suspected SIBO or where I know there's SIBO going on, just to bring a greater degree of symptomatic relief. Now, what are different treatment approaches for SIBO if you know you've got it or you suspect you have it? Well, first and foremost, let's talk about what is the gold standard testing for SIBO. I should cover that probably first. So the gold standard testing for SIBO, I actually believe is an endoscopic procedure where part of the small intestine is actually biopsied. However, that's a pretty invasive procedure that most people don't do. And so what tends to be the go-to test for most of us in the functional medicine space is what's called a 3-hour lactulose breath test. And lactulose is a type of sugar that is not digestible, or let's just put it this way, if you've got bacteria overgrowing in the small intestine, it's going to feed off of that as it moves through the small intestine and produce two potential off gases from that, one being hydrogen, the other being methane. And so what the 3-hour lactulose breath test does is it has somebody on an empty stomach. Typically, this is done first thing in the morning when a person has fasted. They drink a lactulose drink solution, and then it's a time test where by every 15 to 20 minutes, you're blowing into a bag that's collecting your breath, right? And then after all of these breath collections, that data is sent to a lab. And it creates kind of a graph of how much methane and hydrogen gases are measured in each breath sample over time. And so that's measured in, I think, parts per million. And there's a sort of a baseline. I should have actually brought a graph to show you guys, to share my screen. I don't have that, so I'll just describe it. There's kind of a baseline normal, and you want to see those numbers within a certain normal range. And so if you've got this condition, you can be positive in terms of just having too much methane production. You can also be positive in terms of having too much hydrogen production, or you could be positive on both ends of the spectrum. So both gases are important to measure, and then it's very important to look at what those parts per million are vis-a-vis the time elapsing, right, during the test. And it's preferable to do a 3-hour test versus a 2-hour test because, again, some people have slower motility, and generally speaking, it's thought in those cases that we're actually capturing a little better read of what's going on in the small intestine. Now, with this particular test, this isn't always, but often, you'll see a correlation between a methane positive result with a more constipation prone case of small intestinal bacteria overgrowth, and a correlation between a hydrogen positive result and a more diarrhea prone case of small intestinal bacteria overgrowth. Not always, but usually. So it gives a lot of great information. And as a practitioner, looking at one of those tests can help me validate what a client's been telling me about their symptoms and, definitely affirm whether or not they have SIBO, but then see if the type of gas production is correlating with what typically it should. Do you find yourself getting up super early on work days in order to get done with multiple runs to the bathroom? Or waiting and waiting to finally have a bowel movement? Has living your life around unpredictable bowel movements and other chronic gut symptoms left you feeling trapped, stressed, and dealing with anxiety? There are often hidden factors and stressors driving these symptoms, factors that your doctor isn't trained to help you find. Getting to the bottom of these factors, along with the right nutritional approach, is the key to resolving your symptoms. Interested in learning more? Click the link to grab my free e-guide. So that's the test that we use to actually kind of verify that, yeah, there's a problem going on here. It looks like there's bacteria that are fermenting this lactulose drink. You've got likely overgrowth in the small intestine. Now, what to do if you find that? So there's really 3 different ways to eradicate or, in a sense, treat this problem. The first one is through pharmaceuticals, and as I go through these 2, I should mention that there really isn't one that's preferred over the other. Sometimes it's just a question of what does the client prefer, what seems most reasonable to them. Sometimes it's a cost effectiveness issue, and then thirdly, sometimes certain clients will just respond better to certain treatment approaches. So I'll just go through all 3 of them. So the first one is pharmaceutical, and typically the go-to pharmaceutical that's used to eradicate SIBO is rifaximin. Now, this is a drug that sometimes isn't covered by an individual's insurance, and in that case, it can be quite costly. So if you were to go to a GI doctor, have yourself assessed for small intestinal bacteria overgrowth, they tried to prescribe you for rifaximin, that might get denied, and then they might look for a second kind of similar go-to antibiotic to work in place of that, something like, say, neomycin, right? Now, the thing about rifaximin that's actually kind of interesting and makes it on the spectrum of pharmaceuticals, I think a more useful pharmaceutical is that it's designed to stay in the small intestine, so that if a person theoretically were to take a treatment of rifaximin, it wouldn't release within the colon where your beneficial bacteria live and have an impact on eradicating those guys, unlike other antibiotics that tend to be broad spectrum and they'll work in the small intestine and the large intestine, which means that you just have to know they're likely going to kill off some of the good commensal flora as well. Now, obviously, if you can't get rifaximin covered by insurance and that's off the table, any other antibiotic that a GI doc would recommend after that will have that risk of then working systemically and also having an impact somewhat on the beneficial flora in the colon. So sometimes that's a decision point that a client has to think about. Now, since I'm not obviously a medical doctor, I don't have prescribing rights. This is not one of the options that I work with when I'm working with people on small intestinal bacteria overgrowth. But I also find that a lot of the clients come to me because they've already tried drugs. They're not a big fan of drugs. They've had, residual side effects or just no progress with it, or just plain want to do things more naturally. So typically I'm reaching for one of the 2 other options that we can use to eradicate SIBO. The first one is herbal products. And so, specifically in the pro course that I was trained in, we're taught how to utilize these things in specific combinations and kind of alternations to achieve a longer lasting effect. One of the issues that potentially happens when you're dealing with small intestinal bacteria overgrowth is that those microbes can become resistant to certain herbs. And so, just as a sort of proactive way of dealing with that potential, we often like to use simpler herbs in combination so that we've still got herbs on the table to use if a client hasn't responded well, or even if they have and the infection or the overgrowth comes back, we can bring something different in the next time around just to keep the microbes kind of guessing. So the beauty of working with botanicals and herbs is that they are much more complex than pharmaceuticals. In general, they're going to just be, I think, more effective broad spectrum wise. I've seen cases outside of SIBO even where people have had different infections in the gut. They've taken a pharmaceutical to try to eradicate it. They've come and gotten tested with me through like a stool test, and the infection's still there. And then we do an herbal approach and it works beautifully. So herbs are really interesting that way. They're often less problematic. They're not going to be as hard hitting on the good beneficial bacteria growing in the colon, but still be targeted and effective towards the opportunistic mechanism. So that's one of the advantages of working with herbs. Now, as I mentioned earlier, sometimes people don't respond to herbs, and sometimes they actually don't respond to the rifaximin or the pharmaceutical approach either. And so then you might be thinking, well, what do you have left? Like, what do you do at that point in time? So the last way we can actually approach eradication of SIBO is using something called elemental diet. An elemental diet is actually a pre-digested, complete macronutrient powder that you dispense in water and you drink as a liquid. And it's a different therapeutic application than obviously going after and eradicating the bacteria through basically pharmaceuticals, antimicrobials, or antibiotics, right? What we're doing in this case is actually starving the bacteria. And the way this works is that the elemental diet drink is broken down in a way that it requires very little digestive function or juices, so to speak, to break it down and absorb it. And so a person with very weak GI function, or again, who has small intestinal bacteria overgrowth, they're able to drink this, and it's designed to absorb within the first 2 to 3 feet of the small intestine, where that individual is still able to take the nutrition in and fuel their cells, but it's up high enough in the gut that the idea is that most of the bacteria are not going to have a food source, and they'll eventually starve and die off and eliminate through the colon. Because of this, it can take 2 to 3 weeks on an elemental diet for all of that bacterial overgrowth to literally die off and eliminate from the system. Of the 3 options, this is absolutely hands down the hardest one for a client to do, because it literally implies they're going to be drinking their nutrition for 14 to 21 days straight. And most people absolutely just cannot, I should say, or would really struggle to do that. Let's put it this way. I've certainly had clients do it, and we're super happy to do it and be done quickly. That's the upside of this treatment, is that because it's literally staying the course with a liquid drink for 2 to 3 weeks. Once you're through, and you've hopefully cleared the infection, right? Versus if you take rifaximin or herbal antimicrobials, it can sometimes take longer or multiple rounds to clear the infection, depending on how high the gases of methane and hydrogen were. So there's pros and cons to all of these, but it does take, I find, a bit more discipline and willpower to do the liquid diet, because again, just depending on how much how accustomed you are to therapeutic diets, or just how attached you are to having textures and tastes, variety in your food, it can be easier for some people than others to do that type of approach. However, I've also come across cases where that's literally been the only thing left to try, and when in fact we go down that route, it clears. So, I would put it this way: I've never seen an approach fail. Sometimes the question is just which is the right approach to get the SIBO infection to clear for that particular individual. Now, I want to mention that with this particular condition, 3/4 of all SIBO cases are chronic and recurring. And that probably sounds really depressing because that implies a lot of people struggling with chronic illness because, as I mentioned earlier, many people with autoimmune disease have underlying SIBO. Most people with IBS or IBD have underlying SIBO. And I think it begs the question of, okay, why? So if we're able to clear it once, why does it come back? And this is where, as a practitioner, I've spent a little bit more thought and time, and I guess over the last few years, just experience working with clients who were, I guess, more complexly ill, meaning they had underlying toxicities and a lot of other just systems affected, or kind of their personal life story and history had a lot of factors that definitely, lots of adverse events, lots of just things kind of playing into their health picture. This is sort of what I've arrived at and what I truly think is the case with small intestinal bacteria overgrowth. I feel like it is one representation of gut dysfunction that's tied to a deeper problem. And so from my experience, sometimes that deeper problem is other hidden pathogens and infections in the gut, whether they're parasites or sometimes yeast or fungus, right? A lot of times it's tied to a toxicity issue. And again, whether that's a mold toxicity or another biotoxin like Lyme disease, these can be deeper root issues underneath the SIBO that are setting the stage for SIBO to happen because of the compromise, the issue that's going on deeper down, right? And then I think that the other thing that's super important to consider with small intestinal bacteria overgrowth is the role of the nervous system in terms of just governing all of the GI and just the body in general. And of course, nervous system dysregulation is always going to be a huge piece of biotoxin illness, whether it's mold or Lyme. But I think nervous system dysregulation, we could just say broadly, is part of every chronic disease state. And it's a question of just how problematic is that aspect, right? And I won't dive into that in too much detail in today's talk, but I do feel like when SIBO constantly comes back, and we've addressed it many times, and potentially we've investigated the gut and we've looked at toxicities, that it's sort of a residual issue left over from what I would consider more bioenergetic or, even emotional, energetic, nervous system related aspects of the health picture that need to still be worked on for full GI function and health to come back online. And so SIBO can often be kind of one of those stubborn residual problems that will hang on until those last few barriers to health are worked at. And those can sometimes be the hardest because they might be tied to lifestyle factors, trauma, or just other, like I said, more psychosomatic issues of the health issue that can take time to work out, or might take a deeper level of willingness on the part of the client to go there to resolve.
Did you find this episode informative and helpful? I'd love to have you leave me a 5-star rating. Do you have questions about holistic approaches to optimizing gut health that you'd like to ask? Please leave your question or comment below, and I will be sure to address it personally or cover it in a future episode. Be sure to check the show notes for any resources mentioned in today's episode. See you next time.